My name is Janine Rethy. I'm Division Chief for Community Pediatrics at MedStar Georgetown University Hospital and Associate Professor of Pediatrics at Georgetown University School of Medicine. I am pleased to present our study, Social Connectedness as a Determinant of Health in African American Low-Income Families with Young Children, a cross-sectional cohort study, on behalf of all of our authors, Lauren Clore, Rajiv Agrawal, and Paul Combe. Social connectedness has been defined as an individual's sense of belonging within individual relationships, a group, or a community. There are complex historical, cultural, community, and societal dynamics that drive connection and disconnection, and a growing body of research for connecting social connectedness to health outcomes. In May 2023, the U.S. Surgeon General issued a new advisory highlighting social connection as an important predictor of health and well-being outcomes, potentially outweighing risks like smoking, environment, and preventive health care. Importantly, the report highlights social connection as a likely modifiable determinant of health that can be increased through a whole-of-society approach. Given the significant influence of parental well-being on child health, there is growing interest in research that focuses on social connection in families and its relationship to family and child health. There is a particular paucity of research evaluating social connectedness in families with young children in relation to other social determinants of health. And there are challenges with studying and addressing social connectedness because of the absence of consistent, validated measures, especially in the clinical setting. The objectives of the study are: 1, to use a validated tool, the SPS-5, to assess the level of social connectedness in families of children receiving care from a pediatric primary care clinic which serves predominantly African American, historically marginalized communities in DC. And 2, to contextualize social connectedness with other social determinants of health, of parental well-being and food insecurity, to shed light on these complex relationships. This study is a cross-sectional analysis from the Healthy Children and Families Program, a cohort intervention study for families with young children with the primary objective of addressing food insecurity. Screenings used for this study were in the areas of social connectedness, food insecurity, and parental stress. The Social Provision Scale is a widely used scale to measure social connection. It was recently validated to a 5-question short form, the SPS-5. For our results, 96% of children enrolled identified as African American. 93% were enrolled in Medicaid and 7% were uninsured. The average social connectedness score was 14.5 on a scale of 5 to 20. In looking at the relationship between social connectedness and other social determinants of health, social connectedness had a moderate negative correlation with total food insecurity, with a correlation coefficient R is negative 0.43. We saw a negative correlation in all food insecurity questions, with the highest correlation with unable to afford balanced meals. When controlled for parental stress, the correlation still holds in the same direction, but is smaller and not statistically significant. Social connectedness had a strong negative correlation with parental stress and moderate negative correlation with perception of mental health. When controlled for food insecurity, there was still a strong negative correlation of similar magnitude and statistical significance. With this, we present a conceptual framework for these findings, highlighting the complex interplay of social connectedness with other determinants of child health. We offer some plausible explanations to help us understand these relationships. Families with low social connectedness may have fewer financial buffers in place through friends and family or their communities to close the gaps when food is running low and may engage in less meal sharing. Our results suggest that in families with young children, parental mental health may be an important mediator in this model. Low social connectedness can decrease a parent's ability to buffer individual or structural stress. Increased stress and poor mental health can disrupt the completion of activities of daily living and attainment of basic needs. Similarly, families experiencing food insecurity may experience social stigma that can exacerbate their social isolation and increase caregiver anxiety around the capacity to provide adequate food for their children. In conclusion, this study, focusing on families with young children who have been historically marginalized, adds to the growing body of research supporting the inclusion of social connectedness in the holistic paradigm of health on individual and community levels, particularly as we aim towards decreasing health disparities. The findings of the study also carry practical implications for screening and interventions in healthcare settings.